Good afternoon, everyone. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. I'm happy to introduce a new program that Orange County Healthcare Agency will be launching today called What You Feel is Real campaign to address mental health during COVID-19 pandemic. This community outreach campaign is designed to encourage Orange County residents who are emotionally impacted by the COVID-19 pandemic to reach out and seek support during this time of great stress and uncertainty. One's mental health should never be put on the back burner, especially during a pandemic. And I'm hopeful that What You Feel is Real program will be very helpful to our county residents. In addition to those that have become infected by the virus or those we have tragically lost, there are so many others that have been impacted in ways that are often overlooked. Many have lost their jobs, have been unable to pay bills, have lost their loved ones, or face isolation due to having to work from home. This campaign, which will appear in newspapers, transit shelters, digital and social advertising, will offer direct links to phone numbers for free county resources available to the community. Additionally, these resources will be available to the entire Orange County community, including those whose first language is not English. Here in Orange County, we want our constituents to know that we are here to support them. Our healthcare agency and all the hardworking individuals who work day in and day out to protect our community are here to make that happen with this campaign. Next, I want to briefly address the continuing concern over the failure of California's CalReady COVID reporting system and how it affects Orange County. On Sunday night, following a week of uncertainty statewide of CalReady's COVID-19 case count reporting system, California Department of Public Health Director Sonia Engel resigned. Governor Newsom has informed the public that the technical problems that caused the case information statewide to be undercounted would be fixed by the end of this week. While this is promising news, it is disappointing that this issue happened in the first place. For months now, the board has been asking questions and raising concerns about the data, what it means, how it is reported, and how it should inform policy decisions. Our residents have the right to access to accurate numbers. Our healthcare agency, the public, the Board of Supervisors, and our cities rely on this vital data to best determine how to respond to the change in case counts and reports of COVID-related deaths. We can't do so with incorrect information. To that point, Dr. Chow pointed out on Tuesday that the county expects to receive very large numbers of test results in the coming days because of the backlog. So we hope that as we move forward, we can work with the state on having accurate, up-to-date information for us to address this pandemic in a timely and efficient manner. I want to continue to remind the residents and visitors of Orange County to please wear a face covering when you are in a public place and unable to properly social distance, as well as follow hygiene and social distancing guidance. Compliance with this guidance will help us get out of this crisis faster. We must also remember that as we protect public health by social distancing and wearing a mask, we need to allow people to go to work safely and responsibly so they can pay their bills and feed their families. In closing, I want to let the public know that today I visited frontline health workers in Orange County. These hardworking individuals have been working 24/7 fighting this virus. Some of them haven't taken a day off since this pandemic began. I want to say thank you, all the healthcare workers, for all that what they do. Dr. Chow, you have a great team, and thank you. Especially this week is National Health Worker Appreciation Week. In celebrating our hardworking, dedicated health workers, we have to say thank you to them for all that they do to protect us, not only today, but want to say thank you to them every day. Today, I'm joined by CEO Frank Kim, Orange County Healthcare Agency Director and Acting County Health Officer Dr. Clayton Chow, who will provide an update on the county's COVID-19 numbers, as well as the county's response and mitigation efforts to this outbreak. I am also joined by Deputy Agency Director of Healthcare Agency Behavioral Health Services, Dr. Jeff Nagel, and CEO of Mine OC, Marshall Moncrief, who will be discussing the What You Feel is Real campaign in more details. Now, I invite Dr. Chow to come up to the podium. Dr. Chow.
Thank you, Chairwoman Steele. Good afternoon. I'm Dr. Clayton Chow, the Orange County Healthcare Agency Director and Acting Healthcare Orange County Health Officer. I would like to start by providing an update on the cases reported to us today. Our cumulative case count will increase by 348 cases to bring us up to 42,171 confirmed cases in Orange County. 24 deaths will be reported, and our hearts sincerely go out to the family and friends of those whose lives have lost to this virus. Our cumulative death total to date is 769 citizens in Orange County. I want to encourage the community to continue to practice physical distancing, wear a face covering, and wash your hands frequently. Please learn more at ochealthinfo.com/forward. Slow the spread. The state has indicated that the issue with the CalReady, the electronic laboratory reporting system, have been addressed and the backlog of cases has been resolved. However, at this time, movement of counties on and off the list is still on hold until further notice. Now I'd like to address the TK to 6th grade waiver application process at the county level. Orange County Elementary School, TK to 6th grade, can continue to submit a completed waiver application to TK-6waiver@ochca.com. Let me repeat it again, TK-6waiver@ochca.com. That would be the number 6. I will review completed applications in consultation with the California Department of Public Health once we are consider moving out of the monitoring list, specifically on the case rates. And as you know, for county that on the monitoring list for less than 14 days, who are not off the monitoring list for less than 14 days, in order for us to submit the application, our case rate per 100,000 have to be less than 200. And like I said, because the state has put the monitoring list on pause, we won't know. I'm hoping that we will find out by the end of this week, which would be tomorrow. The health agency will post a list of approved waiver application on our website. To date, we have received approximately 50 waiver applications. These waivers are currently going through an initial screening to ensure completeness. None has been approved or denied at this time. Please visit ochealthinfo.com/forward novel coronavirus and look for the school waiver process sections of the homepage for more details. At this time, I would like to invite Dr. Jeff Nagel, Deputy Agency Director for Behavioral Health Services, to come up and speak further about our upcoming mental health outreach campaign. Dr. Nagel?
Well, thank you for this opportunity to talk about the behavioral health response to COVID-19. COVID-19 is not just a physical disease or a disease that affects us physically. It also is affecting the economy, it's affecting us financially, and it's affecting us emotionally. During these uncertain times, we recognize that Orange County residents may be experiencing distress, and the message today is that we are not alone. What we're doing today with the launch of What You Feel Is Real campaign is really promoting the well-being of our community, consistent with the mission of the healthcare agency. We want to ensure that the community knows about available mental health supports and resources and how to access them. And today we are proud to announce the launch of the campaign and to encourage residents to reach out and to seek support. It's more important now than ever to take care of yourself and each other, supporting all of our mental and physical health needs. We are all in this together. And during this time of physical distancing, it's important that that doesn't become social distancing. Remember to reach out and connect with others. So about the campaign, we all need help sometimes, and asking for it is the first step towards recovery. The message of the What You Feel Is Real campaign is simple. Reach out and seek support. The broad-reaching campaign will target the entire Orange County community, and as Chairwoman Steele mentioned, it will be in the register, on transit shelters, and in digital and social media. In addition to the advertising campaign, we have created a toolkit for the community that is available to our community partners, who we know are vital to helping us spread this message. The toolkit includes a script to help when talking to persons or groups, and sample newsletters and social media copy. The toolkit and social media posts will be translated into a variety of languages to further penetrate specific Orange County populations, especially those disproportionately affected by COVID-19. So this toolkit, as well as a variety of other mental health resources, are available at the following website, ocgov.com//COVID. So that's ocgov.com/COVID. In addition, I did want to mention that there is a warm line, the NAMI warm line, which is available 24 hours a day, 7 days a week, for people who need a resource to speak with. The NAMI warm line number is 877-910-9276. That's 877-910-TALK. It is a free and confidential telephone service available to the entire community. I wanted to thank Be Well Orange County for participating in this campaign, helping to shape it and to share it with the broader Orange County community, including many organizations working in mental health in the community every day. And it is now my pleasure to introduce the CEO of MindOC on behalf of Be Well, Marshall Moncrief.
Thank you, Dr. Nagel, Dr. Chow, Chairwoman Steele. Thank you, Mr. Kim. My name is Marshall Moncrief, and I'm the CEO of MindOC. We are a mental health organization working to support the community collaborative known as Be Well Orange County. And so actually, there could be many people here speaking on behalf of Be Well Orange County, and I'm grateful for the opportunity to speak on behalf of the community and their effort together to improve the mental health system of Orange County, public and private, and to improve the mental health and well-being of our community. Before COVID-19, the community had rallied together, identifying that mental health, substance use disorders were on the rise, and that the only way that we could address them would be together, holding hands. Enter COVID-19, and that need has gone higher. We need to do more, and we need to do it faster. And so we're leveraging the public-private partnership of Be Well Orange County, and we're grateful for the County of Orange and their leadership in the effort, and the opportunity to participate in this important campaign. I think Dr. Nagel said it right, that the stress, the suffering, and the strains of COVID-19 are real. No matter what your role in this community might be, you're feeling it, and we want you to reach out. We want you to seek support. We do that for all physical illnesses and ailments, and we need to do the same for mental health and emotional health support. And so we're very encouraged in this difficult time in that we're watching the hospital community, the faith community, the academic community, and we're watching not-for-profit organizations, community-based organizations rally together to increase their efforts to be available to the needs of the community. And so on behalf of all of them, we want to be there for you. And so we're very pleased to participate and support this important campaign, What You Feel Is Real, and an effort for all of us to speak up, reach out, and be there for each other. I'll just reiterate what Dr. Nagel had put out there in terms of the NAMI Warm Line. They're terrific, available 24/7, and the number, 877-910-TALK. And then we're very encouraged by the county's leadership and what they've done with the support website at ocgov.com/COVID. We're going to be here. We're going to be there for you, and we're going to be there together. So thank you very much. Thank you, Chairwoman Steele. And we'll get through this. Thank you.
Thank you, everyone. And we're now ready for questions from the media. Moderator, do we have questions?
Thank you, sir. And as a reminder, ladies and gentlemen, if you wish to ask a question, please press 1, then 0 on your telephone keypad. You may withdraw your question at any time by repeating the 1-0 command. If you're using a speakerphone, please pick up the handset before pressing the numbers. And when asking your question, if you would please mute your line after asking your question to preserve the audio quality on the call. And our first question comes from the line of Paul Anderson with City News Service. Please go ahead. Your line is open.
Hi. I wanted to ask about how you're providing some of the mental health counseling. With COVID-19, is it over, devices with like telemedicine, and then also, the resources you have available? If you could sort of expound on that in terms of how many counselors would be available, and wondering also if you're seeing an uptick in demand for services from healthcare workers, since as the chair indicated, they're working very long hours.
Thank you for that question. I'll ask Dr. Nagel to address that.
In March, when the governor issued a stay-at-home order, behavioral health had to transition how we were providing services. It was an effort that had been underway for years with the state, and in a matter of months, COVID made it happen. That transition was to shift from in-person services to telephonic and telehealth. We are continuing to build out our capacity for telehealth services. We are equipping our staff with laptops that have the cameras and speakers so that they can be capable of delivering those services both remotely as well as in the workplace. Behavioral health clinicians are essential workers and have been showing up and are present every day, 24/7. So not all of our services are being provided that way, but we continue to provide services. In terms of demand for services, we mentioned the NAMI warm line earlier. The NAMI warm line call volume has gone up by approximately 50% during this time since March, year over year. The media has reported that hotline calls in LA have seen similar spikes, but Orange County's numbers have not shown that same trend. It is the warm line instead that has seen the increase in call volume. As it relates to healthcare workers, we have actually targeted resources for healthcare workers and provided both on the website that was mentioned earlier, as well as through our community counseling program, specific resources and outreach for healthcare workers. About 20% of the calls coming into the counseling program are COVID related, and I don't have the exact breakdown of how many of those are from healthcare workers, but that is a targeted outreach.
And next we turn to the line of Nick Gerda with Voice of OC. Please go ahead.
Hi, everyone. Thanks for taking questions again. I had a question. Curious for your overall assessment of where Orange County is at in terms of the virus spread and whether it's slowing down. Obviously, there's been problems lately with testing results data for the last few weeks, but experts point to hospitalization data as a more precise metric of where the community spread is at. It's reported with a different system than the CalReady case system that's been affected lately. And then we've been seeing hospitalizations fall over the last month back to where they were in June. Currently about 440 patients in Orange County hospitals with COVID, down from a peak of 722 about a month ago. So I was curious your assessment of where the county is at overall in the pandemic, where things go from here. Are they getting better? If so, what do you attribute that to? And how do behavior and the choices people make shape which direction this goes from here?
Thank you, Nick. That's a very good question that you heard up and down the state, not only from the public, but also from the health officer to the state as well. And so you probably heard me talk about it before, that I'm cautiously optimistic, because if you follow the number, as I know you do, we've seen a trend, a decreasing trend, even in hard-hit county like LA and Imperial County and San Bernardino. We all have seen a decreasing trend. Because of the issue with CalReady, we are now receiving on a daily basis all of the backlog number from the state, and staff are scrubbing because certainly even before the issue occurred, there are a duplicate number that we have to take them out in order to make sure that the number would make sense. And so one can extrapolate that because of the number of hospitalizations have decreased, that perhaps the number of transmission in the community also decrease. Usually that's what we see is a spike in the number of positive cases would occur first, and then followed by people who are getting into the hospital because of severe symptoms. And so I'm hopeful, as you pointed out, our hospitalization has dropped dramatically. So that's good news. And those numbers are correct because, as you know, we collect those numbers from a different system. And so the hospitalization number, a real number, is the positivity cases and the total cases that we are anxiously waiting to see, and the number today is about 300 or so, so that's a good sign. And hopefully we're not getting a large number. As you aware, yesterday it was over 1,000 cases, so we're getting there. I think we are heading the right directions. As is related to what happened, why do we see a decrease? And I think it's because there's been a huge effort statewide in messaging the non-medical prevention piece of COVID, and that is, folks who are sick, stay home. If you don't need to go out, stay home, especially people who are vulnerable. If you have symptoms and you expose someone, make sure you inform people, and there's a huge effort statewide to do contact tracing in the community, as well as wearing a face covering. We've noticed that a better or improved percentage of people who are compliant in the community to this face covering issue. Wash your hands frequently. We know all of our partners from city government to community-based organization to educational entities to a faith-based entity has been helping spread that message of those non-medical intervention on prevention measures. So I'm very, very happy that that's happening. And of course, you've noticed that we have closed down certain sector from indoor activity, and clearly we've seen a lower transmission rate. And so it's multifactorial. But again, if you ask me, can I pinpoint exactly what activity is very hard? The minute you have community-wide transmission, it's very hard to pinpoint what one single activity or one single event that would make a difference. I think all event and all activity make a difference. So again, wear a face mask, stay home if you don't need to be out, and then hygiene procedure. So thank you for that question, Nick.
And next we turn to the line of Colleen Shelby with the Los Angeles Times. Please go ahead.
Hi, thank you for taking my questions. I wanted to know if today's numbers include any of that backlog data, if the county has received any of that yet, and do you have any guess at this point as to when the county might come off of the state's watch list whenever the CalReady system is resolved and the watch list is unfrozen?
So yes, the numbers do include the backlog, and based on the numbers that we see today and analysis from our team, we do think that we are below the 8% threshold that has been an issue for us in the past. You may recall that at our peak, I believe Orange County had a case positivity rate of 14.9%, and the numbers now are below 8%, but we'd like to see that confirmed by the state monitoring data. So we're looking for that posting, which hopefully will occur tomorrow. But throughout that process, our local hospitals have been fantastic partners, and we've had ICU capacity as well as ventilator capacity. And the testing numbers, there's also a measure for that. But with the opening of our Anaheim super site, we've increased the volume of testing that's available within the county. So we think that we're looking good. But again, we can't confirm that until the state posts their monitoring record. So we look forward to that.
And next we turn to the line of Ian Wheeler with the Orange County Register. Please go ahead.
Thank you. Three-part question for Dr. Chow. First, on the backlog, the CalReady data that has dragged the county's case rate and testing positivity for weeks. you said the county's backlog would be answered by the end of this week. Do you have a sense yet of how many Orange County test results were affected by the data issues? And are you pretty confident that today's case rate, 116 per 100,000, and testing positivity of under 8% are closer to what they actually are, or do you think they'll keep climbing? And when it sounds like we'll know for sure tomorrow or following days if we'll know for sure that these figures are accurate. Second, as the backlog is being resolved, we have a clearer picture that testing decreased in late July and has climbed back up since then, which is unexpected considering the opening of the Anaheim Convention Center testing site in the middle of the month. So I'm wondering of thoughts of potential causes of that decrease in testing. And third, the HCA, I think yesterday, added a new number of days off the state monitoring watch list on its tracking website. Does your office think Orange County will be off the watch list soon? And if so, how will that change our public health strategy?
Thank you, Ian. So the first piece about the backlog, if you remember, the state announced that by, I think, Monday or Tuesday of this week, the lab completely enter about 300,000 backlog test results into the system. So I'm hopeful that that's it. We don't see any more large number. But again, I'm cautiously optimistic. So we'll see what our number will be tomorrow. Secondly, as you pointed out in our own dashboard, we also did our own calculation. But of course, there's always will be a difference in number because it depends on what time of the day we pull the data from the state. So for us, we pull it up at 6 o'clock in the morning, and then staff will spend the entire day to scrub the data and calculate the data. And then the state might post it at 12, and then they get more number. And so there's that small delta between the two number, and so we have decided that we're going to follow whatever the data, the number that the state published. And so, but with that said, I'm very confident and optimistic that our number are truly very close to the state number. And then the last piece is you saw a bump or a decrease, and I think we did see a decrease in number of people who went for testing, and that decrease, I don't know, is it because certain site that they go to had a longer specimen running days compared to the Anaheim super site. As you know, when we stood up the Anaheim super site, the average of turnaround time for the test at that time in some major lab was about 5 to 7 days. And then when we stood up our site was able to give us the turnaround time somewhere between 48 to 72 hours. And in fact, there was tests that we were able to run, and people was getting the result within 24 hours. So I think that account for the fluctuation in the number, but nevertheless, it is still less than before. Our efforts continue to be, folks, if you're positive, if you are symptomatic, and if you have been exposed, we want you to get tested. That's the reason why we stood up the super site. We want to ensure that people who need to be tested get tested, number one, and number two, that our turnaround time is fast, because that's the only way we can make appropriate clinical and infrastructure decision. So great question. Thank you, Ian.
And next we turn to the line of David Singer with KNX 1070 Radio. Please go ahead.
Yes, hi. A question about the deaths. I understand that hospitalizations are dropping. The assumption is cases are dropping, but the deaths are not. We had a record number of deaths last week, I believe. You have 24 deaths today, and it looks like 19 of them are from community spread. Is there a concern that you're doing something wrong?
So I think when we look at the death number, it's not necessarily, so when we report today 19 cases, it's not necessarily that 19 people passed away yesterday. And that's why on our dashboard, we post the date where the death was reported. And if you look at our dashboard, there has been a drop in the trend. And I think the issue is because of the way hospital entity report the death cases into the system, and then the system have to again go back in and say, is this a COVID-related death or not? So that process takes time. By regulation, supposedly somewhere between 7 to 8 days that a death need to be informed to my department. But we know there have been delay as well. I remember that there was cases where we have to go back and backdate the date to like 3 weeks, etc. So again, I encourage folks to look at our dashboard where we report the death, because we do report by the date when they actually passed, and not take it as, oh, there's 24 cases, so the day before there was 24 people died. So important question for me to reiterate that important point. Thank you.
We have a question from the line of Spencer Custodio with Voice of OC. Please.
Hi, thanks for taking our questions. Mine is on reopening. As the trends look like they're getting better, hospitalizations going down, the testing positivity looks like it could be below 8% once, the backlogs are finally cleared out and, everything matches up with the state. My question is, would the county then move to reopen things like indoor shopping malls, movie theaters, a lot of the businesses that are kind of restricted because the county's on that watch list? And, if so, is there a concern about another spike in cases, because numerous epidemiologists and frontline doctors and, infectious disease specialists / doctors I've talked to really attribute it with a wave of reopenings that happened in May and June, which led to those case spikes that we saw, and then that led to the hospitalizations and the deaths. So is there a concern on that front? And, will the county hold off a little bit and consider just maybe one sector at a time? Say we'll do shopping malls, see how that goes, and then we'll go to movie theaters, or how's the county going to handle that?
So that is actually, that's of all the questions, I have to say that this is the most important question as our data looks improve, right? Is the whole notions of how do we safely reopen for the second time sector that we have closed indoor services. And currently the guidance from the state is that the state will make that decision in conversation with local health officers. So currently, oh, I just remember I didn't answer the clock. So we started to count out, lack of a better word, and when we go off the monitoring list, and that was a request from our school, because of all the guidance currently, the state said for any county that are off the monitoring list for 14 days, then the school can all reopen for in-person education. And that's why we started that clock. But for any other business sector, the decision will be made by the state. And so we're looking forward to making that decision together with the state. And so currently I don't have an answer for you, but I think that is the right approach, is to open sector by sector, of course. So that's a great question. I think I'm going to stand here, CEO Kim. Operator, next question, please.
Thank you, sir. Next, we turn to the line of Licia Robinson with the Orange City Register. Please go ahead.
Thank you. Yeah, this question is about the mental health campaign. As you know, as you mentioned, a lot of people are struggling during this difficult time, but not everybody is necessarily in an immediate and severe mental health crisis. So what kind of resources do you have to offer people who either maybe don't have health insurance, or whose insurance doesn't cover the kind of ongoing mental health care that might help them?
Yes, thank you. That's a very important question. From the healthcare agency perspective, we want to make sure that people who have no access to care come to us, and that's why the warm line, again, is 24/7 and is completely free for anyone in Orange County. But I'm going to ask Dr. Nagel to come up and talk a little bit more and perhaps share about the educational effort that the Be Well movement also have started with us.
Before I answer that question, I wanted to make a correction in something I stated earlier. 877-910-WARM, not 910-TALK. My apologies for any confusion. The number has been posted on the screen behind me, but the number for the NAMI WARM line is 877-910-WARM. So the question, going back to access to mental health for those who are not in severe mental health crisis. We do have, the reason I wanted to get the proper number for the WARM line is that is available to the entire community. But in addition, we have a number of resources that are available for those who have Medi-Cal or who are unfunded. And if you go to the website that was mentioned earlier, ocgov.com/COVID, we have a mental health resource page, and that is filled with resources for families, for older adults, for healthcare providers. And so I wanted to make sure that that resource is also known. Listed in there is the community counseling program, the phone number for that program, which is a community counseling program that is more for the anxious and the stress, but not the severe kind of crisis or severe mental illness. Dr. Chow, you wanted me to also mention about our partnership with Be Well, and one of the ways that we have partnered with Be Well Orange County and with Mind OC is through a model called Collective Impact, where we have really identified some of the ways that we can partner with our community-based organizations to really reach into the community much more broadly than any of us individually. As we have been discussing within the Be Well meetings, we have all been providing silos of excellence. We've been providing excellent care, but it's known to a small number. Really, one of the things that the Be Well movement is doing is making resources available and known to the entire community. So I hope that that answers and is responsive to your question. Thank you.
And next we turn to the line of Matthew Leslie with Fullerton Observer. Please go ahead.
Hi, thanks for taking questions today. I have a question about services available for homeless people as well. The shelters are all full right now, is what I understand, and there are still homeless people living out on the street or in their vehicles. What other county beds are available for people in this predicament?
So there's a number of services that are available. So remember, within the Orange County system, there are shelters that are operated by cities, and then there are shelters that are operated by the county, and shelters operated through nonprofit organizations. So there's a number of those shelter beds. The county shelter system, when I checked this morning, I believe our courtyard facility was running around 160 in terms of population, and the Bridges shelter was approximately 140. So there's still capacity at those programs. And then within city shelters, I can't speak to that directly, but currently within our Project Room Key program, we are sheltering anywhere from 500 to 600 homeless. And so we have outreach programs available. So We have been engaged with that community, not only with local law enforcement partners, but outreach staff, but also including the nonprofits that provide outreach to different sectors of the county. So we still have beds available, and we certainly are available to assist. And if we require additional motel acquisitions for the room key program, that is something that I have authority to do and I've committed to doing.
As a reminder, ladies and gentlemen, if you'd like to queue up for a question, please press 1, then 0. Next, we have a follow-up from the line of Nick Gerda with Voice of OC. Please go ahead.
Hi, yes, I had a follow-up about translation for sign-ups for the Anaheim super testing site. Dr. Chow, you had mentioned on Tuesday's board meeting that there's currently no options to sign up for that site other than English, but you mentioned that your staff are working on getting that translated. So I was wondering what the time frame is for that, what languages it'll be translated into, and why so far that hasn't happened already in the month that the site has been open. I know that Restaurant Grants program announced last week is available in multiple languages, but the testing site sign-up still is only available in English. So I was curious on why that is, what the timeline is to translate it, and what languages it will be available in.
Yeah. Thank you, Nick, for that question, because it's given me an opportunity to also clarify with you, because I think it's you who wrote that article. I think when I said that at the Board of Supervisors a meeting on Tuesday in terms of the language issue is only pertaining to the super site, because it talked to whether or not the super site is available for in other languages. And clearly I had conversation with staff this morning and yesterday. We know that we have English, Spanish translated already, getting ready to be posted. Vietnamese is also getting ready to be posted. And we're looking at whether or not there's a necessity for Korean, the other threshold language. Remember, the super site is not the only site that the county has. We have other sites as well, and the Latinx Equity Initiative also run 4 different tests per week, and all of those sites have people who help folks to register to get tested in English, in Spanish, in Vietnamese, and by phone. And in Korean as well, because that initiative worked with multi-ethnic community organization. And so I think, unfortunately, I only speak to the super site, but then was mistaken for, in general, that county site do not support the languages. That is actually not correct. But it really brings us to the point where we really need to support the super site by posting the pre-registration in 2 different languages. So there's already talk about how do we do more than just pre-enroll and offering drop-in testing. So more to come. Thanks, Nick, for the opportunity to clarify that with you specifically. Thanks.
And we have a follow-up from the line of Spencer Custodio with Voice of OC. Please go ahead.
Hi, thanks for taking our questions again. This one is for Dr. Chow. I was covering the Anaheim City Council meeting on Tuesday and hit the hotspot areas of Anaheim, where the 2 cities make up, at least as of yesterday's count, I haven't had the chance to crunch the numbers today, was about half the deaths currently in the county and about 37% of the cases currently in the county, just for those 2 cities.
Yeah, thank you, Spencer. In fact, I just came off from our monthly update meeting with the entire collaborative, the Latino Health Equity Initiative. Currently, as I mentioned before in answering Nick's questions, we run 2 testing sites in Santa Ana and 2 testing sites in Anaheim per week. And on the average is about 300 tests a day. I look at the data this morning, and the positivity rate for both cities, one is at 19.4%, or 7%, sorry, 19.7%, and the other one is 19.1%. I believe Santa Ana is 19.1%, and then Anaheim is 19.7%. Obviously, compared to our current county average positivity rate that we calculated as 7.7. Clearly, it is more than 2 times higher. We know there's a need to get people tested. We know that we need to go and outreach into the community and educate the community on what does it mean by being exposed and how important it is to get tested. And when you're sick, do all you can with the support, the services, and the supports that this collaborative is able to support folks to stay home and not work. Is multifactorial, right? And we believe that when we look at the positivity rate, there is a small drop. So that's good news. And I believe that the initiative is moving towards testing 7 days a week now. So starting this next week, we're going to be testing 7 days a week, utilizing different partners that run the labs. And so we're hoping with that we can create more early prevention and early intervention to make sure that we slow down the spread and if not mitigate the spread. As far as death, and remember we talk about at this point the data per city is reported by the address where someone live, not so much where the activity happened there. And you've heard me talk over again that just because we show a large number in certain region of Orange County, it doesn't mean that the other regions are safe, put in quotation mark, right? We know that transmission is in the community. We know that people are transients in terms of where they live versus where they work. We have people who live in Orange County but work elsewhere in other counties. And then we also have people who live in other counties come work in Orange County. So we can't just myopically looking at one community. Now, obviously, Santa Ana and Anaheim at a higher rate compared to a higher number compared to other city is just because it's compacted and people live in closer condition. And so obviously we want to go in there and pay attention to those social issue, the living space and the access to transportation, etc. So it's multifactorial. Again, and early on, we do know that wherever there's a higher number, you probably have a higher death rate because it correlates. Similarly, if you have an area where you have density in terms of people living and you have larger transmission, of course, you also have a larger death. And also the other piece is there are folks who skilled nursing facility, probably a bit more in those cities as well. I know we pull out the number for skilled nursing facility as is related to transmission and death in every city, so we can look at closely those non-conjugated living folks, the community, what does that rate would look like. But the huge effort now we are paying attention to Anaheim and Santa Ana, and that would be a model for us to look at other areas as well. So great question. Thank you. Do we have time for another question, or are we good? One more question, operator, please.
Thank you, sir. And if there are any additional questions, we invite you to press 1, then 0. Again, please press 1, then 0 if you would like to enter the question queue.
That's it.
And allowing some time for folks to queue up, we have no questions in queue, sir.
Thank you so much, everyone. We'll see you next week.